My phone is on silent mode.
I need to ask my doctor.
You want to cue the question? Multiple sclerosis is a complex disease. It's a long-standing immune-mediated disorder that is characterized by recurrent attacks on the eyes, the brain, and the spinal cord.
My eyeball just stuck at one side, so it's the right eye. I went to 4 different eye doctors, and all of them told me that it was nothing got to do with my eye problem. I went to the hospital to see a neuro doctor, and that's where I met my doctor, Dr. Shanthi, and she then diagnosed me with MS because my MRI results had showed I have lesions.
I jalan 2-3 step, I nak jatuh. I rasa macam okay, something wrong. And I bagi tahu my husband, doktor suruh buat MRI. Daripada MRI tu nampak blok-blok dekat
white spot.
In Malaysia, a couple of studies have been done, and the prevalence is about 3 to 4 per 100,000.
It was hard to accept at first. It was like something new, we never heard of it. What is multiple sclerosis?
What really worried me at that point of time is the medication, because I knew there was no cure.
But there's a lot of things that we can do to help you with your symptoms. So I always tell my patients that it's potentially treatable. First of all, when they come in with an attack, we would give them steroids to try and speed up the recovery and see how their recovery is after the steroid.
So I ambil steroid tu, lepas 3 hari doktor masuk, doktor kata okay, hari ni I nak tengok you jalan. I bangun, I start jalan, and benda tu hilang.
People who live in the northern latitudes where there's lack of exposure to sunlight, low vitamin D, twins, those who have a father or mother or a sibling affected, they seem to be more prone for getting MS as compared to the general population.
Throughout the years, I was able to meet people with MS. I even joined the society group.
The commonest type of MS is that of relapsing remitting type. The attacks or relapses, as we call them, they come and they go, and patients actually recover fairly well from those attacks. Now, as time goes by, usually about 10 to 15 or 20 years, these patients, they may get the attacks, but they don't recover very well, and they go into a more progressive type of disease, what we call secondary progressive type.
After the steroid, after she felt okay, everything, we went on to have a second baby. The condition also okay, no relapse. But after the third one, the relapse datang balik lah. Kali ni memang got worsen lah. It suddenly go down like that. She fell down, memang having difficulty walking, started to use wheelchair.
In 2011, that's where I became partially lost my vision. So after treatment, I got back my full eyesight. And then I had my 3rd attack. My leg became very heavy. I couldn't walk. I love to drive. And when it affected my driving, it affected me as an individual too.
Some of the common signs and symptoms of MS can be blurring of vision, sometimes accompanied by pain. They may have problems with numbness in the face or in the limbs that come and go. They may have unsteadiness walking. They may have problems with their bowel, bladder.
Most important, I think the support system must be also strong for MS patient.
There are people out there who have gone through what you have gone through. Get yourself network with people.
My keyword is you kena positif.
It's all about the mindset at the end of the day.
Jangan sebab susah nak jalan tu you tak boleh gelak-gelak, buang apa yang you rasa tak boleh.
For me personally, my character that I really look up to is Dory from the Finding Nemo. Keep on swimming until you find your way, because it's not at the end of the day. It's actually a new beginning in our life.
Treatment is evolving, it's improving. So be very positive and keep that hope.